Hi YouTube viewers, this is Mouse, aka Melissa Ari, aka known on here as Anna Phoenix. I'm doing a response video to Pokerface Nino, hope I said your username right, and your video Bipolar in Media versus Real Life, which I thought was a really good video actually. I just wanted to make a comment because it's hard to comment in words, written words, as well as it is to just do a video response so that you can see that I'm sincere and I'm not trying to act like I know more or any of that crap, because I can understand how, I would take it that way. And I don't want to offend you at all, because that's not my intention. To give you just a quick, brief introduction to who I am, what I've been through, where I'm coming from is what I'm saying. I was diagnosed with bipolar when I was 14, along with obsessive compulsive disorder, and a few years later I was diagnosed as having a personality disorder called borderline personality. And this is the umpteenth time I've tried to record this, so if I make any bloopers, screw-ups, whatever, I'm just going to deal with it, and I'm not even going to try to edit it out, and we're just going to do it like this, okay? Sorry, I'm getting frustrated, and I really want to make this video, this comment video. So, okay. So I've been, in psychiatric care for 17 years. Ever since I was 14 years old. I am 31 now, and, unfortunately I've been on a kaleidoscope of medications. And when you mentioned the show Homeland and the chick in the show, you said claims to have bipolar disorder, and they were rambling off medications that she takes, right? And you mentioned clonazepam and lithium. Well, with the clonazepam, that's a benzodiazepine. That's the family of medication that's in. And benzodiazepines are usually, a lot of them are used for anxiety, insomnia, muscle relaxants even, mild ones at least. But yeah, for many different things. But one of the main things that it's used for, really is mental disorders, mental problems, People who have lots of anxiety, it helps calm them. Now, clonazepam, I don't know if I've actually been on it. I've been on a lot of medications, like I said, so I can't really remember if I've ever been on it. But I know from being on diazepam, which is the word for Valium, they gave that to me during the day. I wasn't taking it, to sleep. I was taking it during the day to help with my anxiety, because I had really bad social anxiety, and I still do. I mean, that's kind of why it's hard for me to do these videos. And that's why it's been really hard for me to do this response video, because I just get tongue-tied, and then my obsessive compulsive crap kicks in, and it has to be perfect, and yeah, so I'm trying to ignore that right now. But so you mentioned the clonazepam, and to me that doesn't seem out of the ordinary to mention that for a bipolar patient. And then you also said lithium, and then you also said, okay, maybe in the 90s, early 90s, 80s, lithium would have been prescribed. Well, I don't know what part of the United States you're from. I mean, you have an American accent, so I assume you're in the United States. I'm in the Midwest, and out here they do still prescribe lithium for bipolar patients. I don't necessarily agree with that, because it's a very dangerous medication, extremely dangerous medication. And when I was on it, I've been on it a couple times between 2003 and 2010. I can't remember the exact years. That's why I'm saying between those dates, or those years. I mean, I know I've been on it twice. And the first time I took it for an entire year, I was on lithium carbonate. There's, I believe, 3, maybe 4 different kinds of lithium. I'm thinking there's only 3. But I look up every medication that my doctors give me, because, I have anxiety about doctor's giving you the wrong medication. I don't know. I'm weird. I'm weird like that. I'm like super Nancy Drew about stuff. You know, I have to look it up. I have to know everything about it before I can consume it. I didn't used to be that way. I don't know if it's an obsessive compulsive thing or what it is, but the last few years I've gotten really bad about, like, I can't even take an over-the-counter medication without looking it up online, not just the back of the box. I'm talking about I actually have to look it up either I have this app on my iPhone that's, it's actually an app that my doctor uses, but that's not how I found out about it. But oddly enough, I told my doctor about this, and she's like, oh, yeah, I use that app. It's called Micromedics Drug Information. And, I mean, I look everything up there. And then I cross-reference it sometimes. And then sometimes I even Google it just to make sure. Because I am just, like, super obsessive about it, I guess. I don't know. I feel like I can't take something unless I know everything about it. Which can be bad, because not all the side effects that they list actually happen. But yeah, unfortunately, they still do prescribe lithium. And I don't know why. But when and then also you mentioned that the best thing for a bipolar person, you know, is to be on, well, you said something like that, to be on a mood stabilizer. And that I totally agree with you, on, because the most stable I've ever felt was when I was on an antidepressant and a mood stabilizer. And the reason why they've always given me antidepressants is because I've had, like, really horrible problems with the depression part of, you know, bipolar. It's like once I get stuck in depression, it's like I'm stuck there. And it would last for so long, but it would be so deep of a depression that, you know, I would do horrible things. Like, you know, you know, have tried to commit suicide in the past. And now I know this particular thing is not necessarily bipolar. That's actually borderline personality. The cutting, I have so many scars. I mean, this is just a few. I don't even know if you can see them very well. And then there's some, like, deeper ones. You really can't see them that well, but, like, that's just some of the more noticeable ones. Yeah, you really can't see them, which makes me feel good, because I'm usually kind of like, you know, I have anxiety about people seeing them, because I get the weirdest questions asked about that. But so no, I totally agree with you. That's something I've been having a problem with, though. My doctor that I've got now, he's awesome in the fact that he doesn't think that, you know, you should be all drugged up, which is awesome, because I know personally, I don't know if this is just a bipolar person's point of view or a normal person's point of view. Can't really tell, since I've always been bipolar and I really don't know anything different, because I've been told I had symptoms of it ever since I was a baby, literally an infant. So, but I mean, that my brain has always been extremely precious to me. So to be all doped up, it just really, really sucks, and I would not like that at all. So I think most bipolar people to some degree are like that, though, because I've known quite a few bipolar people, and they're all kind of more than kind of, they're all very intellectual people that I've met, at least. It just seems to be something we all have in common, being very, you know, let me pick your brain kind of people, you know, or you know what I mean? Like, I don't know, we're just brainier. I'm not saying we're brainier than non-mental people, but I've just noticed we seem to be very brainy people to some degree. Breed of people, as I like to put it. But yeah, so I'm still trying to work with my doctor to put me on a mood stabilizer, because the antidepressant I'm on is not taking care of it all. And I know it's not supposed to. I mean, and I was doing better with my moods until, well, I've been having to deal with a lot of crap lately, a lot of bad things, you know, a couple of deaths, actually, one of them being my father. And even before that, though, I was having, you know, really bad mood swings. As my brother and I joke about it, I'll say, you know, excuse my language here, but I'll say, fuck you, but I love you, to my brother. Like, and when I sometimes I do it jokingly, just to be silly, but it started off as me actually saying that to him. And then literally 2 seconds later being like, I love you, bro. And, yeah. So, I don't know, I'm all over the place sometimes with my moods, and then sometimes it'll literally be like switch flips and I'm in a totally opposite mood from what I was at. And, you know, I don't know, my family's so used to my mood swings that I guess they just don't notice it the same. But, and my doctor, he seems to think that I'm having more problems with the borderline personality, so I don't know. But like I told him, I'm like, but bipolar disorder never goes away, because once you have that chemical imbalance in your brain, you always have it. I mean, I wish there was a way they could fix that, but they've never figured out a way to do it, to my knowledge at least. I've never heard of any surgeries you can have to fix that chemical imbalance. Honestly, if there was one, oh, I would have the surgery. You bet. I mean, yeah, it'd probably be dangerous, but I'd have the surgery. Because I hate feeling as much as I do. It's a blessing and a curse. You know, that's how I feel about it. Because I feel like I feel way too much of everything, pretty much. But anyways, that was my response. I'm sorry it dragged out so long. We're at 12 minutes now. But this is the first video I've watched of yours, but I have a feeling I'll be watching more of them. I'm going to subscribe to your channel. Be kind of nice to have a little network of bipolar friends online like this to, like, compare our illnesses, you know? Maybe share some tips, you know, on how we can help each other out, you know? Like, positive thoughts, positive vibes, you know, when other people are down. That's why I'm on here, is because, you know, maybe I can help somebody somehow, sometime. Maybe even just cheering them up for a second. That'd be awesome. You know, that would make me feel like, hey, my work here is done. So, yeah. I'll shut up now. Bye-bye. Peace.